Hello, everyone. I do hope you're keeping well. Welcome to the Dental Job Diaries, episode 4. I'm over the moon today to welcome our latest guest, Suzanne McLean, who is the Training Development Manager with Clyde Munro. Today's episode, we're going to be exploring the Clyde Munro Training Academy and what they're doing to make sure that people are getting all the right training and support for new people coming into the sector. Suzanne, it's great to have you on the show. Welcome. How are you?
I'm well. Thanks, Lewis. And likewise, thank you very much for having me this morning. But yeah, it's a great day. It's good to be here. Thank you.
Absolutely. No, thanks very much for coming on. Today really is going to be quite interesting because I know, obviously, from reading the press and seeing what Clyde Munro do, you've invested a lot of money recently to your advanced and clinical skills centre. Do you want to sort of touch on that and sort of explain what that is for people listening today?
Yeah, absolutely. It has been what a year, and we're only halfway through. But the Advanced Dentistry and Clinical Skills Centre, we're set in Perth. So we deliberately chose Perth to be in the heart of Scotland so that we could attract or really allow all of our clinicians that are spread out all throughout Scotland to be able to have access to this academy. But really what we want to provide is clinical education to dentists, nurses, our support team, and also the wider dental community. Currently, the space is being used by our support teams to come together for face-to-face meetings, something I think we're all relishing, that we're all enjoying getting back together and having these face-to-face meetings. Because, I think Zoom and Teams, that they've been on our radar far too long now, I think. So they've enjoyed that. But I guess if you were to think about a mission statement, it's really to enhance the skill set of all of our employees within Clyde Munro across all our teams, so that in turn they can deliver the highest standard of care to our patients. Ultimately, that's what it's all about. It's absolutely is an amazing space, and I would invite anyone, if they were in the area, to call in and have a look.
So what's your role within sort of Clyde Munro training development? I mean, it must be quite fulfilling, seeing people come in and sort of upskilling and seeing them develop, because
it is it's very satisfying, and it's the nicer side of HR. I would guess I fall under the HR umbrella, being in learning and development, and it's nice to be able to provide all these opportunities for our support team, for the administrative teams, for our clinical teams, associates, and to be able to provide that for them, just so that they can also grow professionally. There is obviously, as clinicians, and associates, the nurses, they all have to do mandatory continual professional development, but being able to provide that in-house for Clyde Munro and the associates and the employees, that's quite special. So there's not many other dental people to do that. Perhaps they'll have the departments, but not the facilities. So in our department, to be able to source courses, to be able to offer that or negotiate perhaps a preferential rate for Clyde Munro, that's also something that's quite exciting. But it's really nice to be able to put these on, and generally people are happy to come together and use it as networking as well, because as Clyde Munro, we've got 80 practices now, and they're dotted around the whole of Scotland, from the borders, Galashiels, right through to Orkney, those places like that. So it's really interesting. So not only am I providing courses and training for Clyde Munro and our associates and our employees, but just getting to meet other people in the field that are delivering these courses and what they bring. And things are changing all the time. There are some topics that are hotter than others, and clinicians will seek that out for the latest schools of thought. Again, we've moved away from quite heavily prepped teeth. With restorations, it's all about being minimally invasive now, and there are different techniques that are utilised to achieve that as well. So just being able to tap into that and then be able to showcase the latest offerings and bring it to Scotland. Really, we have a lot of our, I guess, the big name speakers in the field. They deliver their courses, in and around London, definitely south of the border. And primarily because that's where a lot of the big facilities are housed, and so people travel to those facilities. But now that we have the academy in Perth, we can bring these big names to Scotland, and which we have done as well. So yeah, it's exciting.
Oh, it is. I mean, it's you're definitely setting yourself apart from from the rest of the competition in terms of what you're doing, and any organisation that is investing in people is brilliant, because a lot of candidates for that fact want to be able to understand, especially when at interview stage with any employer, what that employer is going to be able to help them achieve to get them to the next levels. And any candidate that wishing to advance their career with Clyde Munro will very, very quickly see got enhanced facilities such as what you have. I think it's tremendous. Really, obviously it's taken a lot of
absolutely.
I
agree, Lewis. I think, but it's important that it sets us apart, perhaps from other industry players, and that's the aim. It's a very competitive market at the moment, and when we do invite associates that are looking to make a move to come with us, come and grow with us, and as part of our recruitment retention strategy, it's really important, because clinicians are looking for so much more now, not just a practice to base themselves, but it's all of the enhancements that will go with joining a big group such as ourselves. And again, we have the academy, but not all of our courses take place at the academy. So we could run webinars, for example, and we'll collaborate with Haleon. Formerly, they were GlaxoSmithKline, but some of these other industry players will collaborate with them, and they'll provide continuing professional development, or what we call CPD. And we can run these webinars in a lunch hour, so that those associates, practice is a very busy place. So being able to provide these little webinars where they can keep up with their CPD and make sure actually clocking those for their cycle, for their annual cycle, that's really important. And then when we have really big courses, we will then invest in hiring an external venue, so that we can bring lots more of our associates together as well. So for example, if there were going to be 30 to 40 delegates, we would make sure that we've got the appropriate space there, so that they can come and speak to some of the big name presenters and trainers.
I guess one thing that springs to mind is primarily the kind of the engagement that you're able to fulfill with your team by having kind of webinars during working hours, because that's key, isn't it? Keeping everyone new ideas. I think again, that you've got that pinpoint perfect, if I'm honest.
That's great.
I suppose one thing I'd love to be able to ask is do share some success stories from somebody coming in and seeing them kind of grow and develop. What have you seen so far?
Well, it's relatively early days with the Academy, Lewis. So we, like I said, in February 2023, so this year, we did open our doors and ran our first course. We've had some courses from periodontics to guided biofilm therapy, endodontics. In terms of success stories, it's early days, but already we've got dentists returning to their place of work and putting into practice some of the new skills they've learned. So from being able to improve the aesthetic of composites or composite restorations for their patients, to improving irrigation technique for their endodontic treatment. So already the skills that they're learning, they're putting into practice. We've already had some delegates come back and ask for a return of the speaker to come on and perhaps talk about further their areas of expertise. They're already asking, they've enjoyed that particular course, and would we bring that person back and talk about some advanced techniques as well. So that's really exciting. So for me, it's reassurance that we're on the right track, and that we're using the right people to come and deliver these courses, these presentations. So it's a variety of courses where people could come for a whole day, 7 to 8 hours CPD, or we run 2-day courses, 2-day hands-on, right through to webinars, like I mentioned, that could either happen in their lunchtime or perhaps an hour in the evening. But we're also running talks. So we invite people to come along and listen to talks from specialists within their field. So we've got a couple of oral surgeons coming in. I've got someone that is particularly interested in occlusion, and they'll just actually come and give a talk. So that can be attended in person at the Academy, or we'll actually be broadcasting that as well as a webinar for our associates that are, again, geographically a little further away. So it's a bit tricky, I guess, to come down for the 2 hours, but they still have access to that as well. Yeah, so it's exciting.
Courses would you say you happen to run on a weekly or monthly basis, or does it differ? I mean, who comes up with the topics, or is it a case of getting feedback from the team? I mean, how does that work?
Yeah, there's actually quite a few different areas. So last year we had sent out a survey. So it's really asking our associates and the teams, what are they looking for? Who would they like to listen to? In their opinion, who are the key speakers that they'd like to meet? So we took that. We also have discussions with the clinical team and our senior leadership team as well. So again, we're catering for the dentists, the nurses, but also we have our practice managers, we've got our administrators, and then of course the support team behind the scenes. We've got our finance team, we've got HR. So it's making sure that we deliver to everyone within the team those things that are relevant to them in their role. So yeah, we speak to everyone across our wider team, and then we also, by keeping up to date with the dentistry shows, they're really a great source of names, of up and coming names in dentistry that are trying to make their mark with their training, their presentation courses. So that's a great place to go and meet people, or I'll go and listen to them and then invite them, would they be interested in coming and delivering something for Clyde Munro, which is really good. And we're also really fortunate, actually, the Academy, the Advanced Dentistry and Clinical Skills Centre, is actually a partnership with Dentsply Sirona. So as you may have heard, they're global leaders in dentistry, and they also run their own education program. So because we have this partnership with them, I'm privy to their education program, and there are quite a few speakers there of excellent caliber. So we've been able to use those, and I've been introduced to a lot of their speakers and the education team, and we share ideas there back and forth. And we can I have used, should I say, the past few months, a lot of the speakers that are key opinion leaders for Dentsply Sirona as well. So it's a really good starting point for us as well, but a great resource.
I mean, looking ahead, what future developments or advancements do you anticipate for the Advanced Dentistry and Clinical Skills Centre and advancing education and patient care?
Yeah, again, we are in early days, but it's an exciting time because we're just growing at such a rate at the Academy. Again, it's been so busy already, and we're just halfway through the year, but we are developing a complete suite of educational content that will fulfill the needs of our clinical teams. We've already started to receive requests, like I said, for a return of our speakers. And who knows, in the future, we could be offering postgraduate certificates, diplomas, and even master's programs. There are things that we're exploring to bring in the future. And we run other programs. So not just do we have the courses at the Academy, but Clyde Munro, as a company, we offer a Strive program. That's for our trainee dental nurses. So they have formal training external to Clyde Munro, but we like to support them in their learning. And we'll bring them together about 6 times over the course of their 12 to 18 month formal training, one for networking, but also to bring them together, have that space where they could come and talk about their experiences, have those shared experiences. They're all in the same boat. So I'm really proud of our Strive program. We also have a Flying Start program. Generally, that's aimed at clinicians, our associates that are in the early years of their career, perhaps 5 years since they've graduated. And we run a program, again, over the course of the year. We'll bring them together about 5 times, and we'll bring in lecturers, speakers, we'll have networking sessions. We'll bring them together, perhaps for an away day, have dinner. And not only do they find that beneficial from a networking point of view, because as we know, they're also busy in practice. It's nice just to down tools for a little while, come together, but also have that educational content to it as well. And we've heard great feedback. So we did our first Flying Start program that kickstarted off October 2022, and we just finished this month. And the feedback's been phenomenal. It's been great. And we had approximately 25 associates attend that. So our aim is to run that again in 2024, and we're just planning that now. So we're planning our schedule for 2024 already. And myself, Nicola Logan, I know that she's done a podcast with you guys. So she's head of HR, and she's really also interested in L&D. She comes together and we bring the clinical team together to plan. So we've got all of that going forward. So I feel the Flying Start program is going to be even better next year, and I'm quite proud of that. But it's an exciting time anyway in dentistry. I think there's a lot of changes afoot because of digital dentistry and the digital workflow. And then another hot topic at the moment is AI. So it's really just encompassing, I guess, encompassing all that's AI and not being scared of it, embracing it. So we're already piloting the use of AI with radiographs and how that can assist as a tool, a diagnostic tool for our clinicians. So that's quite exciting. And we're already, as you probably know, by speaking with other team members within Clyde Munro about our digital workflow and our pledge to have all of our practices digital with intraoral scanners within the next few years as well. So there's 80 at the moment, and half of that already have the current Prime Scan intraoral scanner in practice. So it's setting courses with that, supporting our teams with that. But it's an exciting time, yeah. So who knows? I'm sure there are courses out there that aren't even on the radar yet as we start to learn more about AI.
I mean, it just sounds to me that, you guys are looking at everything in so much fine detail, and actually following through with ideas into practice. And well, that's evident, isn't it, from your from your academy that you have, and it's great. But also, I think it's going to be good long term for bringing people further afield, wishing to come and practice here in the UK, Scotland. So that's really going to help, because smaller practices are unable to devote the time to really train, educate people coming in, not from just a standing start, but even experienced people overseas. So I see that being really exciting.
It is. I mean, our plan is in the future to be able to offer our training academy with Clyde Munro. So there will be an opportunity to rent this space. It's an amazing facility. I mean, it's amongst the most sophisticated training centres of its kind in the UK. We have a simulation environment with magnification for all users. So at every station, there's a microscope. There's 8 stations for delegates, and we've got our master station or a demonstrator station that also has magnification. It has live streaming. The site offers intraoral scanning plus CAD/CAM for all of its users. So we have that insight. Again, because we've made this collaboration with Dental by Sirona, they also can showcase the very latest in their offerings. For example, the latest cutting edge technology with CBCT, so like 3D X-rays. We've got the latest one of those in our facility, along with lateral calf. And it can also take OPT, so we can do all of our training. In fact, in November, we do have some training there, a masterclass on CBCT, both levels. And being able to have that face-to-face is quite unusual. The only other place I'm aware of, I think, might be down in Weybridge. So just having that opportunity. So we have that for Clyde Munro, but again, being able to offer this out to other dentists if they want to present their own courses, or we have other speakers that want to use our space to deliver courses of their own as well. So yeah, there's lots of exciting things ahead for next year. Absolutely.
Suzanne, it's been absolutely brilliant to kind of hear your passion, and obviously look, it's been probably a whirlwind of a year so far, But it's been great to have you with me today, and obviously, the viewers as well, learning about all the things that you guys are doing and putting into practice. So, look, thanks so much for coming on the show.
Oh, you're most welcome, Lewis. It's been a pleasure. Thank you. Thanks for having me.
I'll be back again soon, I hope. But no, it's been absolutely fantastic. It really has. So it'll be good to catch up with you again soon.
Absolutely, likewise. Thank you.